It is an incredible honor and a privilege to be speaking today and representing my colleagues, the nursing staff, the physicians, the allied healthcare professionals, and everyone who works at this hospital. I've known the Yurkovich family for many, many years. Like Tony, I am a child of immigrants and have some Croatian heritage. I also have some Chinese heritage as well, hence the last name Poon. Like Tony, I'm a Richmond boy. I grew up here from the age of 5. Many of you know Harold Steves as a city councilor. I know him as my grade 2 teacher. Like Tony, I went to medical school at UBC and was fortunate enough to come back and work in Richmond and establish a practice to join this community and this hospital, and I have never looked back. I've every day felt so fortunate to have come back to the place I grew up. At Richmond Hospital, we have an incredibly talented team of healthcare providers, and in many ways, we are family. Today's announcement is incredibly exciting. Like many others, I work in the original building in the hospital through the day, and although it has served our community well for the past 50 years, it is time for a new acute care tower. The community of Richmond has grown by leaps and bounds, and even over the 40 years that I have been here, the population has quadrupled. And there is no sign that this growth in the aging population is going to stop. This means that we are facing many new challenges in terms of how we deliver health care to the community. Today, the North Tower has many deficiencies. It is virtually costing more to update and maintain that tower than it would cost to build a new tower. Medicine and technology have changed, and so have our infrastructure needs. Patients are always seeking and deserving of the absolute best healthcare available, and physicians and other healthcare providers are highly motivated to provide that care. We need to have the best equipment and facilities to fulfill that mandate, not just for now, but for future generations, and to be mindful in the same way that the community built the North Tower 50 years ago, that we are building for the future as well. Having infrastructure allows us to build and retain a community of healthcare individuals who are also seeking a home in which they can provide the best care possible. I can speak of the gratitude of every healthcare worker at the hospital, to our donors, and to every level of government who has provided us with the support and facilities that we need. Dr. and Mrs. Yurkovich, and all the donors who are present here today, on behalf of everybody who works at Richmond Hospital, I thank you for giving us the hope and the promise for an even brighter future in Richmond. We are committed to our patients, and we could not be more excited to see your donations become the seed for a new acute care tower. Thank you so much.